In a quiet clinic room, a 34-year-old woman sits across from you, explaining her symptoms. Over the past 3 months, she noticed persistent double vision. It comes and goes, but has been progressively worsening. You begin a thorough neurological examination, focusing on her eye movements. When you ask her to follow your finger, something peculiar happens. Her right eye fails to adduct, unable to move inwards towards her nose. At the same time, her left eye abducts, but with a noticeable, coarse nystagmus in that outward motion. You begin a thorough neurological examination, focusing on her eye movements. When you ask her to follow your finger, something peculiar happens. Her right eye fails to adduct, unable to move inwards towards her nose. At the same time, her left eye abducts, but with a noticeable, coarse nystagmus. In that outward motion, you summarize the key features of INO in his mind. Impaired adduction of the eye on the same side as the lesion, horizontal nystagmus of the contralateral eye during abduction. You further consider potential causes. In a patient of her age, multiple sclerosis rises to the top of the differential list, as it's a common demyelating condition that affects young adults and often targets the ML. Vascular diseases such as a small stroke could also be a cause, but it is less likely in this relatively young woman without significant risk factors. Before proceeding, you mentally rule out other possibilities. Cranial nerve 3 palsy would affect multiple movement of the eye, including ptosis and a dilated pupil, neither of which are present in this patient. Cranial nerve VI would cause impaired abduction of the affected eye. Supranuclear palsy typically affects voluntary eye movements and would not produce the specific findings seen. To confirm the diagnosis and investigate the underlying cause, you decide to request an MRI of the brain, focusing on the brainstem and midbrain regions where the MLF is located. If MS is confirmed, you plan to discuss management options, including corticosteroids and disease-modifying therapies. If vascular disease is suspected, risk factor management and anticoagulation may be considered. As the woman leaves for imaging, you feel confident in identifying this classic but fascinating neurological condition. Internuclear ophthalmoplegia, a testament to the intricate coordination required for something as moving one's eye.